So this is week 8 microelectronics, implantable devices, and rodent surgeries, biomedical application. This is a problem solving session. I am Arpita Biswas, a PhD scholar from IT Jodhpur from electrical engineering department. So this is more details about me. So this session we are going to discuss about some of the MCQ question. Like this is the first question: in which format 3D printing files is stored? First option is the .stl, .tx, second the .txt, third .txt, and option D is .png. So please go through the question carefully and try to find out the right option. So the right option is option A .stl. Okay. So next move toward the question number 2. Which software is used for mechanical designing and modeling? First the SolidWorks, second the Origin, then MATLAB, then OrCAD. So what is the right answer? Please try to solve the question. So the right answer is option A, the SolidWorks. Okay. So next move toward the question number 3. SLA stand for stereolithography, standard lithography, stereo loop, standard lithography. So what is the right answer? So the right answer is option A, the stereolithography. So move toward the question number 4. Why LUB is used in SLA printers? First to divert the laser. Second to form the fringe pattern using the laser. Option C is to focus the laser on the resin. And option D is to illuminate the printer's base. So what is the right option? So question number 4, the right option is option C, to focus the laser on the resin. Okay, so next move toward the question number 5. Which parameter is important for etching? First is the selectivity, then option B is the sensitivity, option C is the mole fraction, and option D is the region of interest. So what is the right option? So, what is the right option? Question number 5. The right option is option A, the selectivity. So, next move toward the question number 6. Which is the part of the spinal cord in a rat's anatomy? SP, TPL6, IC, or all of this above? So, the right option is all of the above, option D. Next, move toward the question number 7. Correct ascending order of spinal laminar architecture, dorsal column, spinothalamic, spinocerebellar, and option B is the spinocerebral and dorsal column, then spinothalamic, or option C is the dorsal column, spinocerebral, and spinothalamic, and option D is none of the above. So, what is the right option? So, the right option is option A, the dorsal column, so spinothalamic, then a spinocerebral. So, next move toward the question number 8, the etchant for etching gold, potassium iodide in DI water, then iodide in DI water, or potassium iodide and iodine in DI water, and option D is none of the above. So please go through the question carefully and try to find out the right option. So, what is the right option? The right option is option C, the potassium iodide and the iodine in DI water. So, next move toward the question number 9. Which photoresist transfer except pattern of the mask onto the wafer. First the positive photoresist, then negative, then all of the above or none of the above. So what is the right option here? So question 10 is, what is the primary purpose of neural microneedles implant? First option is to stimulate the muscles growth. Second, to record and stimulate the neural activity. Option C, to enhance the body circulation. Option D, to regulate the body temperature. So what is the right option here? So what is the right option? The right option is option B, to record and stimulate the neural activity. Okay. So next move toward the question number 11. What is the key advantage of microneedle based neural implant over the traditional electrode? First option, minimize the tissue damage. Second option is the larger size for better stability. And option C is the increased electrical resistance. And option D is the less biocompatibility. So please try to find out the right option. So what is the right option? Question number 11. The right option is option A. Minimize the tissue damage. Okay. So next move toward the question number 12. What material is commonly used for fabricating the neural microneedles? First option is the silicon, then copper, then aluminum or the rubber. So please try to find out the right option. So what is the right option? The right option is option A, the silicon. Okay. Next, move toward the question number 13. Which of the following is the major challenge in neural microneedle implant? First, the long-term biocompatibility and durability. Second is the high power consumption. Option C is the limited surface area. And option D is the excessive weight. So what is the right option? So the right option is option A, the long-term biocompatibility and the durability. Okay. Next, move toward the question number 14. How do neural microneedles interact with the neurons? First option, they penetrate the neural tissue to record or stimulate the electrical signals. Option B, they block the neural signal to prevent the overactivity. Option C is that they release the chemicals for neurotransmitter regulations. Option D, they provide the mechanical support to neurons. So, what is the right option? So, right option is option A. They penetrate the neural tissue to record or stimulate the electrical signals. Okay. So, next is the question number 15. What is the typing size range of neural microneedles? First option is 1 to 10 millimeter. Then, second is the 10 to 100 micrometer. Option C 1 to 5 centimeter. And option D is 5 to 10 nanometer. So, what is the right option? So the right option is option B, 10 to 100 micrometer. So next coming to the questions of question number 16. Why is microneedle implantations preferred over the traditional deep brain electrode? First option is the less interactive, invasive and lower risk of inflammations. Option B is the more expensive but highly efficient. Option C is provide the largest signal strength. Option D is easier to implant in any tissue. So, what is the right option here? So the right option is less invasive and lower risk of inflammation. The option number A. So next move toward the question number 17. What is the role of flexible microneedles in neural implant? First option to conform to tissue movement and reduce the immune response. Second option to increase the electrical resistance. And option C is to prevent the neurons from fringe too frequently. Option D is to create the permanent scars for better connectivity. So what is the right option? Question number 17. The right option is option A to conform to tissue movement and reduce immune response. And then move toward the question number 18. So option A is the right option. Then question number 18. Which biomedical application commonly used neural microneedle implant? Option A is the brain computer interference. Option B is the skin hydrations monitoring. Option C is the cancer treatment. Option D is the artificial heart implant. So, what is the right option? So the right option is the option A, the brain computer interference. Next, move towards the question number 19. What type of signal do neural microneedle implants typically record? First option is the physiological signals. Second is the optical signals. Option C is the chemical signal, and option D is the thermal signal. So, what is the right option? So, what is the right option? The right option is option A, the physiological signal. Okay, next move toward the question number 20. What is the main function of the spinal cord? Option A is the to transmit the signal between the brain and the body. Option B to store the memories. Option C to generate the red blood cell. Option D to regulate the hormone secretions. So the right option is option A to transmit the signals between the brain and the body. Okay. So next move toward the question number 21. Which part of the spinal cord contain the sensory neuron cell bodies? First is the dorsal root ganglion. Second is the ventral horn. Option C is the central canal, and option D is the anterior median fissure. So the right option is option A, the dorsal root ganglion. Next, move toward the question number 22. What type of neurons are found in the ventral horns of the spinal cord? First is the motor neuron, second is the sensory neuron. Option C is the inter neurons only, and option D is the Schumann cells. So right option is option A, the motor neurons. Okay. Next, move toward the question number 23. What which spinal cord structure carries motor signal from the brain to the muscles? First option is the ventral root, second is the dorsal root, option C is the dorsal horn, option D is the central canal. So the right option is option A, the ventral root. Okay. Next, move toward the question number 24. The central canal of the spinal cord is filled with what? First option is the cerebrospinal fluid. Option B is the blood. Option C is the lymph, and option D is the synovial fluid. Synovial fluid. So the right option is option A, the cerebrospinal fluid. Next, move toward the question number 25. What is the function of the interneurons in the spinal cord? First option is to relay the signals between the sensory and motor neurons. Option B is to generate the action potential in muscles. And option C to transmit the signals directly to the brain. And option D is to produce the cerebrospinal fluid. So please go through the question carefully and try to find out the right option. So, what is the right option? So, question number 25, the right option is option A, to relay the signal between the sensory and motor neurons. Okay, so next move towards the question number 25. The spinal cord is protected by which structure? Option A is the vertebral column, option B is the skull, option C is the rib cage, and option D is the sternum. So, it is the right option. Option A is the right option, the vertebral column. So, next is the question number 27. Which pathway carries pain and temperature sensation to the brain? Spinothalamic tract. Option B is the corticospinal tract. Option D is the dorsal column pathway, and option C is the dorsal column pathway, and option D is the um, cerebrospinal tract. So the right option is option A, the spinothalamic tract. Okay. So next move toward the question number 28. Reflex the circuit in the spinal cord are responsible for which type of responses? First option is the rapid involuntary responses to stimuli. Option B is the conscious decision making. Option C is the slow controlled movement. And option D is the emotional regulations. So right option is option A, rapid involuntary responses to stimuli. Okay. So next is question number 29. What is the first step in most rapid signal surgeries? So first option is the patient positioning and the anesthesia administration. Option B is the bone graft placement, and option C is the insertions, and option D is the wood closure. So please go through the question carefully and try to find out the right option. So the right option is option A, the patient positioning and the anesthesia administration. So next move toward the question number 30. Which surgical approach is commonly used for spinal surgeries? So first option is the anteriors, second is the posteriors, and posteriors and the lateral approaches. Option B is the inferior approaches only, and option C is the cranial approach, and option D is the endoscopic approach only. So please go through the options and try to find out the right option. So question number 30, the right option is option A, the anterior or posteriors and lateral approaches. Okay. So next move toward the question number 31. What is the purpose of a spinal decomposition surgery? So first option to relieve the pressure on the spinal cord or nerves. Option B to fuse two vertebral together. Option C to remove the spinal tumors. Option D to insert the artificial disc. So what is the right option? So question number 31. The right answer is option A to relieve pressure on the spinal cord or nerve. Okay. So next move toward the question number 32. What is the laminectomy performed for? First option to remove the part of the vertebra or lamina and relieve the pressure on nerves. Option B is to fuse the spinal segments. Option C to place the spinal implants. And option D is to increase the spinal curvature. So what is the right answer? So, what is the right option? Right option is option A, to remove part of the vertebra or lamina and relieve pressure on nerves. Next move toward the question number 33. What is the purpose of the disectomy? First option, to remove the herniated disc that compresses spinal nerves. Option B, to insert the artificial disc. Option C, to reinforce the vertebral. And option D, to widen the spinal canal. So, what is the right option here? So, what is the right option? Question number 33. The right option is option A, to remove the herniated disc that compresses the spinal nerve. Okay, so next move toward the question number 34. What is the key risk associated with the spinal surgeries? First option is the nerve damage and infection. And option B is the increased lung capacity. And option C is the weight loss. And option D is the hair loss. So the right option is option A, nerve damage and infections. So next move toward the question number 35. What imaging technique is often used during the spinal surgical surgeries for the guidance? First option is the fluoroscopy or introspective intraoperative X-ray. And option B is the ultrasound. Option C is the PET scan. Option D is the ECG. So, what is the right option? Question number 35, the right option is option A, the fluoroscopy and interoperative X-ray. So, next move toward the question number 36. Okay. So, what is the final step is mode spinal surgeries? First option, the wound closures and post-operative monitoring. Option B is the bone graft intersections. Option C is the spinal cord stimulation. And option is the lamine laminectomy. So please go through the question carefully and try to find out the right option. So, what is the right option? The right option is option A, the wound closure and post operative monitoring. So, next move toward the question number 37. What type of 3D printing is commonly used for metal fabrication? First is the selective laser melting (SLM). Option B is the fused deposition modeling. Option C is the digital light processing. And option D is the stereolithography. So, what is the right option here? Take your time, but at least try. So what is the right option? Question number 37, the right option is the selective laser melting. Okay, option A is the right option. So next move toward the question number 38. So this is the last question. Which of the following is a key advantage of 3D printing in manufacturing? First is the customization and complex geometries. Second option is the higher material waste. And option C is increased production time. And option D is the limited material choices. So please go through the question carefully and try to find out the right option. So the right option is option A, customization and complex geometries. Okay. So we are ending our session here. Next we will meet next Tuesday, 7 to 9 p.m. Okay.